Hi, I'm Dr. Craig Castanet. Today I'm going to talk to you about core strength, what it is, why it's meaningful, and in what sense it's not valuable. First of all, when you have neck or back pain, we need to treat you effectively for the neck or back pain. Core strengthening doesn't do that, but what core strengthening can do is protect you from insult and provoking symptoms in your neck and back pain. And in the long term, it's important because if you develop exceptional core strength, you can protect your neck and back better. I should limit this to the low back because the neck, while we could talk about core strength there, that has to do with the neck muscles, and it's a little different than the low back, where we have abdominal and pelvic cavity, in which we can manipulate the intra-abdominal pressure and generate high intra-abdominal pressure, thereby providing strength, or rather stability, to this core area of the low back. The low back is also under greater loads, so we don't think about loading the spine and the neck so much as we do in the low back. Anytime we do anything physically demanding on our bodies, it's going to involve the low back, not so much the neck to a much lesser extent. And there isn't a manipulable factor or variable such as intra-abdominal pressure that we can volitionally manipulate in order to stabilize the spine. But let me get back to first principles for a moment. When we speak of core strength, this is strength that involves using these core muscles, which includes many muscles in the low back, as well as muscles on the side and the front of the abdomen. By using these muscles in a volitional way and breathing in a certain way, we can increase the volume in the abdomen and then compress that volume of air in the abdomen to provide higher intra-abdominal pressure. That higher pressure in the abdomen results in greater stability and less extraneous movements in the joints of the little back when we do something that's physically demanding. So, for example, if I want to stabilize my core because I'm going to do something demanding, such as bending over or lifting or carrying or getting in and out of car, in and out of bed, what I'm going to do is I'm going to breathe in, I'm going to suspend my breath, I'm going to contract these core muscles and generate high pressure in my abdomen. The higher the pressure in my abdomen, the more rigid my abdomen, and that transfers to less movement of the little joints in the back, and that means less movement where the discs are. That means that you're not likely to move in some aberrant way, as can happen when we move loads and impose loads on the spine that could injure the discs and joints and pinch nerves. So if, for example, we were going to do something that's very heavy, I'm going to do it very thoughtfully. I'm going to bring also the loads closest to my center of gravity as I can. The center of gravity of the body is about 2 inches in front of the sacrum. So it's somewhere deep in here, in the midline in here, but deep. So you always want to get loads as close to here as possible so that there is as short a lever arm as possible, imposing torque on the low back. Then you want to take a deep breath in, and then you want to hold it and contract all these muscles around here. When these muscles contract, they shorten. That reduces the volume in the abdomen. When you reduce the volume in the abdomen, it increases the pressure in the abdomen. Assuming that we have taken a deep breath in, which drops the diaphragm. Anyway, I don't want to make this too complicated, but I want to make another distinction. In addition to the fact that it's muscles that protect the joints, because imagine a joint, all the bones that we have, I think they're 206, they're all connected by ligaments. If you relax your skeletal muscles and you have bones that are connected by ligaments, but which are not protected with volitional muscle contraction, skeletal muscle contraction, then you have a joint that can flop around and be easily injured. And that's true for the low back, and that's why we talk about core strength. The way we protect it, again, volitional contraction of muscles. In the case of the core, it's all these muscles of the core. And that's a great way to protect the spine. It's not a great way to treat neck and back pain. That's a whole different story. And to address neck and back pain, a better approach to treatment than most physical therapy, which just involves stretching and core strengthening exercises, which again have their place, but not really to address your acute neck and back pain. Another way to treat these things is passive modalities. That has its place, but generally they're palliative, meaning that they don't make the problem better, whatever that problem is, but they reduce symptoms. If the problem is self-limited, meaning rather likely to get better on its own with time, then providing palliative treatments is fine. But if you need a therapeutic approach to treatment, something that actually addresses a pathological lesion which needs redress, then the best way, in my experience, to treat that is not with a conventional physical therapy approach, nor with a chiropractic approach, which has as its conception the idea that joints and things are out of place, but it's rather to decompress the spine, because the spine is constantly compressed over a lifetime, and as it's more and more compressed slowly over a lifetime, it reduces the threshold for provoking pain and symptoms and injuring the spine. And the way older people compensate is they do less and less and less and less. So as the threshold for provoking pain lowers, they reduce their physical activities in lockstep so that they would have less pain than they would if they were imposing the same loads as they did when they were younger. But a better approach to treatment is decompress the spine intermittently throughout your lifetime whenever you need to for the sake of symptoms, and then develop and maintain a strong core so that during the course of your physical demands in your daily activities, you don't injure your spine. Those are the two keys: decompress for pain and strengthen for protection of your spine. That's the best way to deal with these things. So that also addresses the issue about core strengthening. It has its place in the way of prevention, but it's not for treatment of neck and back pain. For treatment of neck and back pain, spinal decompression is the best approach to treatment. It makes the most sense because it acknowledges the natural history of the spine, which is this very slowly progressive degenerative compression of the spine that is initially a product of changes to the disc that include microscopic degenerative changes, and then loss of water content and degeneration, and then slow collapse. That collapse of the discs results in more pressure on the joints. They become another source of pain as this process proceeds. And intermittently, nerves can get pinched, which will cause pain to radiate down your arms or legs as these degenerative changes to the discs proceed. Anyway, if I can help you with your problem, I'm Dr. Craig Castanet in Decatur, Georgia. My number is 404-558-4015. If you'd like to learn more, go to my website, backstrong.net. And from there, if you like, you can go to my YouTube channel. There are a host of videos on all sorts of topics related to the spine, including prevention, surgery, pain management, chiropractic, physical therapy, and treatment. Thanks very much. Bye-bye.